Thank you all for coming. I'm Dr. Mitch Katz. I'm the director of the San Francisco Health Department. We're very proud of San Francisco General Hospital. Thank you. For 125 years on this site, this hospital has taken care of people regardless of their ability to pay, no matter what their ethnicity was, whether they were a man or a woman or transgendered, whatever came forth, we took care of. And we are so proud to be here. We're so proud of this tradition of caring for all who need it in a humane, culturally competent way. And we are so appreciative to all of you who helped us on this campaign. San Francisco General Hospital, when it went before the voters, received 84.3% of the vote. Now what I want you to think about is, when did 84.3% of San Franciscans agree about anything? Right? That we got that high level of vote. Now, we didn't get that because of the campaign we ran. Although we ran a very good campaign, and I'm very appreciative to all of the people here from the labor unions, especially 1021, 10 to 1, who helped us, to the, thank you, to the business community. We were supported by Democrats, Republicans, and Greens. We got great support from the other hospitals, including UCSF. Many people from UCSF are here today, our sister institutions, all of whom really helped us. But that wasn't why we got 84.3% of the vote. We got it because of the people who work here, the care that's provided, and what people know about San Francisco General for over 100 years. That's something that we can be very proud of. Just walking around today, and I'm sure that many of you have noticed that it is for us like a homecoming of all sorts. So my first day in San Francisco General Hospital was as a medical intern, and that was, I still remember the exact date, that was June 21st, 1986. Right here in the Mission Emergency Room. And starting out at the same time was Pat Carr, who's here, who was starting as a nurse in the emergency room at about the same time that I was. And we are all family. Gene O'Connell is here on the end, our long-term CEO. We talk about family relations. If my first encounter of San Francisco General Hospital was as a medical intern, hers was as a mom bringing her children here for care. And I want to know, where else but in the public sector would somebody go from being a mom bringing her 2 children, work her way through nursing school, and ultimately become CEO of the finest public hospital in the United States? No place else but San Francisco General. She deserves so much credit, both for the rebuild and for the reason why people wanted to build. So now it's my great pleasure to introduce the mayor. I will only say, as a way of introduction, that during that election year, what made me most proud was that at every event that he went to, what he said was, there are many things on this election ballot, and you may have your different opinions about the different things. Some of them may pass, some of them may fail. But the one thing that I ask you all to support is the rebuild of San Francisco General Hospital. Mr. Mayor, we'll always be deeply grateful.
Thank you, Mitch. Thank you. Thank you, Dr. Katzen. Well, we're finally here. I remember that it feels like we were literally here just during the kickoff of the campaign, and all the health commissioners, we welcome you and we thank you for your stewardship of our process. But we're finally here at the groundbreaking, and now just a few short years away, 2015, where this extraordinarily brand new hospital will be built. 284 beds, 32 more than the existing facility. We will take this remarkable building behind us, and we will keep it in operation throughout the entire process of rebuilding a new hospital, and then we will basically convert the operation behind us into a new operation and maintain a lot of the facilities so we're not necessarily tearing everything down and just paving something over it. This has been an exercise that has been advanced over the course, the commitment to this rebuild, at least 2 decades. It was fast-tracked by a Senate bill, 1953, that required all public hospitals to meet seismic safety retrofit standards. There was a lot of consternation when that bill passed because people said, well, how do we pay for it? We've got these remarkable hospitals, but we can't meet that mandate without the support. Nonetheless, we fashioned a bond with a lot of trepidation because we were asking for more money than we've ever asked the taxpayers in our history for a general obligation bond. I remember when I first became mayor, we were kind of fast-tracking. Everyone was excited. It was a presidential election the year after I was elected. And they said, we got to go forward with this bond in the presidential election. And I remember sitting down with Dr. Katz, who had worked very hard on this, Gene O'Connell and others, and they said, I asked them those questions, so how much does it cost? They said, well, it's about. And I said, whoa, what do you mean about? They said, well, our estimates. I said, well, who's doing the estimates? And we realized quickly that we needed to slow down and we needed to get this right because you only have one chance to make this ask of the people of San Francisco. And we made a tough decision and people were none too pleased. And frankly, the fingers were pointing in my direction when I said I cannot support going forward in November of 2004 with a bond until we do our due diligence, until we make sure we know how much this thing's cost, and that we can make a compelling case to the people of San Francisco, one that would not meet with the critique and opposition that so many of our bonds naturally are afforded in this city. We spent the last number of years and we put up general fund money. We've never done this in San Francisco. We said we're going to do a lot of the pre-development work. We're going to actually fund through our general fund support to make sure that we get this right, to figure out the mitigations, to figure out the traffic issues, to figure out exactly the design needs, and actually make sure that we're providing a kind of institution that can meet care not 5 years from now, 10 years from now, but 50 and 100 years from now. And I'm glad we did that. Close to $30 million was at risk of general fund money to support those efforts. But the big idea was this. We actually came up with a real number. And it's the first. Have you ever seen a bond on the ballot in San Francisco with a decimal point? $887.4 million. We didn't round it up to $899 million. We didn't round it down because it polled better at $799 million. We said to the taxpayers, support us, but we'll also support you. We're going to do the right thing. We're going to make sure we spend your money wisely, and this is what it will cost. All the experts agree this is what it will cost, not any more. We don't necessarily know how to make it any less, but here's an actual number. And the results speak for themselves. 84% of the people supported the biggest bond, general obligation bond, in our city's history because they felt, I think, respected. They felt like city government was telling them the truth. There was no opposition to this bond because you couldn't oppose it unless you just didn't want to spend any more money. But you couldn't argue against the analysis. You couldn't argue against the due diligence. And I think that's an important lesson here. And I think this day represents an important statement of fact and commitment to the people of San Francisco that they will support things that we could never have imagined supporting as long as we tell them the truth, as long as we're honest with people, as long as we're transparent, as long as we own up. So I'm extraordinarily proud to be here because I think we've formed a new partnership with the people of San Francisco. We're not just building a new hospital, but I think we've built a new relationship with the taxpayers, and I think that will bode extraordinarily well the next time we go back and we say, here's what we need, because we think it's in the best interest of all San Franciscans. So I want to congratulate all of you for your stewardship of this process, for your hard work, for our celebrity doctor who is in every single ad, for being willing to get out front, to the incredible leadership, and I mean this. This guy was supposed to retire years ago. He's not going to be allowed to, at least as long as I'm around, Dr. Mitch Katz, who deserves so much praise, so much credit for getting us here. I noted the commission and all of those that you'll hear from me or hear that are behind me for their stewardship, and to all the men and women that work in this remarkable place that change people's lives each and every day. 100,000 direct lives are changed. But every time I come here, I realize you're not just saving patients. You're taking care of families and mothers and sisters and aunts and uncles and brothers. I've seen it too many times, the faces of those parents. I can't even keep a straight face because it's so difficult to see someone in pain, but to see the smile and the sense of pride that their loved ones have because of the job you guys have done is something magical. And so I'm just happy we're here to extend that magic, to extend our values in the most meaningful and substantive way. I'm so glad we're here to kick off of this remarkable institution that defines the best of San Francisco. Congratulations to all of us for being here today.
Thank you, Mr. Mayor. When I needed for this project to go through to the voters, I needed first the help of the city's elected family. And I'm so proud that in addition to the support of the mayor, when it came forth to the Board of Supervisors, the vote 11-0 in favor. And that shows a tremendous commitment. Several of the members of the board are here, and I think it's not coincidental that they also represent the parts of the city that we care for in the highest number. Supervisor Maxwell, Supervisor Daly, Supervisor Dufty, Supervisor Campos. Thank you so much for being here on this special event. Thank you for supporting us. We really, really appreciate it. As long as also Jose Cisneros, the city treasurer, is here, helps us out on making sure our bank accounts have enough money to deliver that excellent care. We really appreciate it. I also want to say that we're so blessed that we got a direct letter from Mrs. Pelosi, which, as you have undoubtedly noticed in the newspaper, she definitely has other things to attend to, and yet she found time to write to all of us and tell us about her deep commitment to General Hospital, and to say that were it not for the health reform efforts that she's shepherding, which will help this hospital, she herself would be here. We got a beautiful certificate of recognition from the Majority Whip, Fiona Ma, and also from Assemblyman Mark Leno. So thank you so much for all of that. We really appreciate it. Now, you can imagine that one of the many challenges that I faced when I had to accept the idea that Gene really was going to retire was, how would I ever get anybody who could do as good a job running this hospital? But fortunately, Gene, like all very good administrators, had already worked out a succession plan. And she nurtured and mentored and counseled and supported Sue Curran, who has then been able to be our CEO and continue to move the organization forward. So it gives me great pleasure to introduce to you Sue Curran.
Thank you, Dr. Katz and Mayor Newsom, and thank all of you for coming out today to help us celebrate this momentous occasion. As Mitch said, San Francisco General Hospital was founded over 125 years ago, and we were founded to respond to the public health crisis of tuberculosis that was going on at the time. And we're still here. We've been here for AIDS, and we'll be here for the swine flu, and we'll be here for every next crisis that comes along. We're really grateful to the city and the residents who supported the hospital and recognized its value to the community. You showed us that by passing Proposition A with that 84% record. We're really committed to living up to the faith that you have put in all of us. San Francisco General Hospital has touched many lives, and we heard that throughout the campaign as we went around and talked to people. We heard many stories about how they were connected or how someone that they knew that they cared about was connected to the hospital. I'm one of those people. My first encounter with San Francisco General was as a trauma patient. I was brought to the ED after I was injured during a mugging in the city. And I came back as a staff nurse and then came back as a registered nurse working in critical care. And now I'm the CEO, and I'm so glad to be here. I have seen General from all sides, and let me tell you, there's no better team on earth. The entire staff at San Francisco General, the doctors, the nurses, the administrators, the social workers, the pharmacists, the housekeepers, the IS workers, everyone. There's just so many of you. I can't even say them all. I want you to really stand up, and we should applaud you for all the great work that you do. Stand up, please. They really do an amazing job. And we're all so excited because in this new building, we're even going to be able to do a better job. Remember, we're not just here simply to celebrate a new building. We're really celebrating the healthcare services that we're going to be able to provide to all San Franciscans. As the only trauma center in the city, we will continue to bring life-saving trauma and emergency care. We'll also deliver the best geriatric care and award-winning maternal child care and so much more. The new building's going to be filled with original art for the entire community to enjoy. We're really trying to create an asset to the neighborhood and be a center for wellness and a healing environment for the patients, for the staff, and for our visitors. As we celebrate the beginning of the construction, I'm really proud to tell you that the building design and our architects, Fong and Chan, have been honored with a Design Award of Excellence by the California Council of the Society of American Registered Architects. And there is a model in the hospital lobby that I invite you all to come and take a look at that will show you what our new hospital is going to be. Thank you all for coming and helping us to celebrate as we embark on this journey together. Thank you.
We have a saying about staff at General Hospital that Sue and Jean sort of exemplify, and it's that stay 6 months, stay 30 years. I'm beginning to think that may be true of me as well. There is a certain sense, I mean, our mission is not for everyone. This is not the easiest hospital to work in. This is not the easiest work to do. But if you are consonant with our mission, that we are going to treat everybody with dignity, and we're going to offer the highest quality of care to people regardless of their ability to pay. If that mission reverberates with you, you stay 30 years because there's no better place to do that mission. And I think that that's what's special about this hospital, and that's what sets it apart from others. Thank you. Another way that I think that we're different, and I say this as a doctor, is that we are not a doctor-centric hospital. There is a reason that both of the current CEO and the prior CEO are registered nurses. There is a reason why, and I noticed Dion Jones in the audience, someone who set the 5A AIDS model set to go in this hospital, that there is a reason why we have always pushed the idea that it's not a doctor, it's a doctor with a nurse, with a social worker, with a pharmacist, with an IT person, with the cook, that it is the team that delivers the care. And I think that that's, sorry, CNA, yes, everybody who delivers the care, thank you. So that too is special. Also very special is our more than 100-year arrangement with UCSF. Certainly this was tremendously important to me. When I was looking for where did I want to do my training, where did I want to practice, I wanted to take care of low-income people, and I also wanted to make sure that I was the best trained doctor that I could be. And the attraction of this hospital, because it was a UCSF teaching hospital, and it has produced great leaders. I'd like to note Dr. Sandra Hernandez, who's in the front, who was my predecessor. She was also in the special way that many of us who train here are related to one another, whether or not we were physicians or nurses or other professionals. Sandra and I trained a year apart. Dr. Sue Desmond, who is now the chancellor, she was a fellow while I was a resident. And so there are all of these intense relationships that result in the very best of medical care. And there is nobody who exemplifies that best than Dr. Sue Carlisle, who is a UCSF physician, but whose heart is at San Francisco General Hospital, and she's the one who makes all of our faculty practices and all of the clinical work come true. Dr. Carlisle.
Thank you, Dr. Katz. Good afternoon. I would like to add my welcome to all of you for this wonderful event that we have worked so long and hard to accomplish. As was just mentioned, UCSF and the City and County of San Francisco have had a wonderful partnership for many, many, many years. This partnership gets stronger every year, and we now have more than 1,500 employees that work for UCSF on this campus. We work side by side with the city employees in order to deliver seamless care for all of the residents of San Francisco. Exemplified by the strength of this partnership is the wonderful leadership that we have at the top, and we've already mentioned our new chancellor, Dr. Susan Desmond-Hellman. We also have a new dean who's here with us today, Dr. Sam Hagood, and we are very appreciative for the support that we have from our leadership. UCSF employees here include not only all of the doctors, but all of the respiratory therapists, clinical lab workers, biomedical engineers, much administrative staff, and a large number of researchers. The care of any patient requires not only the cooperation between the city and the university, but the cooperation across all of our specialties in order to deliver the quality care that we do. Many of our personnel here at San Francisco General are involved in cutting-edge research. We believe strongly that this research has a great impact on the care that we are able to deliver. The subjects of our research include trauma care, violence prevention, better communication with patients, improved diagnostic techniques, just to name a few. And I would be remiss not to mention that we're a world-renowned center of HIV research and care. In addition to the superlative care and clinical research, we also play a critical role, as Dr. Katz mentioned, in training the future healthcare providers for the next generations to come. These new facilities will enhance our abilities to do that. We attract the best and most dedicated teachers and learners because of our wonderful heart and soul that we provide here at San Francisco General. And in the future, we will continue to fulfill our mission to provide health care and trauma services to all with compassion and respect. And we're excited to be a partner in this wonderful endeavor of building a new San Francisco General Hospital and Trauma Center. Thank you.
Nothing that I do, nothing that the health department does would be possible without the fantastic San Francisco Health Commission. I would like to ask them to stand up as President Illig, Commissioner Tierney, everybody. Thank you so much. Thank you for the support. Thank you for the leadership. Thank you for making things like this rebuild happen. Many of them were hard on the campaign trail, helping us to make it happen. I want to thank also the broader city family. Our fire chief is here, Chief Hayes White. Cute. Our special angel in the mayor's office, Aaron McGrath, who now moved on to another job, but who shepherded that project all the way through. And a very special thank you and welcome up to the podium for Ed Riskin, who's the head of DPW, who's made sure that this project is on time and on budget, and it will be a great facility. Ed?
Thank you, Mitch, and thanks everyone for coming out today. This is a great day for the Department of Public Works. We are responsible for managing the design and construction of this facility, and we're very honored to be serving in that role. We're also very lucky due to the foresight of the mayor and the support of the Board of Supervisors and the pre-development work that the mayor referenced. Although we're just breaking ground today, we're actually well on our way towards delivering this project. And part of that has been assembling a great team of designers and builders to make this hospital a reality. We have Fong and Chan Architecture, and we have Chulin Chan and David Fong here with us. I want to acknowledge them and the great work they've done. We have Andy Ball and the team from Webcore Builders who are going to be building the hospital for us. And we have a team of folks from Jacobs Engineering who are providing the executive construction management. And what we have from bringing this team together is not just modern design and modern construction methods, but we have the most modern means of delivering a complex project like this, where we have all these folks working together, and the pre-development funding enabled us to bring them together. And what that allows us to do is it allows the people who are going to be building the building to sit down with the people who are designing the building to test concepts such as prototyping the base isolation that's going to ensure that this hospital is seismically safe. It allows us to make sure that the way that we're designing this is a way that we can also build it in the most efficient and effective way. It allows us to get ahead in terms of bidding for certain parts of the project, and we just were able to bid the steel package, for example, hitting what we believe might have been the very bottom of the steel market, which is going to save us about $5 million from what we thought we were going to have to pay. So again, I just want to reinforce the foresight that the mayor and the board had in providing this pre-development funding to enable us to work collaboratively and ultimately to get an accurate price, to save money for the city, and enable us to deliver this project. What we bring is the project management, and to do that, we looked across the bay, and there was a guy who was finishing up getting the Highland Hospital built over in Alameda County, and we recruited him here. So our lead project manager is Ron Alameda. I want to acknowledge him. He's leading a great team. He's leading a great team of committed public servants in the Department of Public Works, Joe Chin, Michelle Dia, and Christine Tang. They're supported by Edgar Lopez, our head of project management, and Fuad Suisse, our city engineer and deputy director. And it's with them and me that we are committed to doing as Mitch said, which is bringing this project, delivering it to you on time and on budget as we promised when we got the support of the voters back last November. I also just want to mention that we're not only just building a hospital, but we're building a hospital that will meet the seismic requirements, very stringent seismic requirements that state law requires and that San Franciscans deserve to ensure that we will be safe in the event of the earthquake that we know is going to come. We're delivering this building to be a LEED certified gold building, which means that over the life of the building it will perform better, yet use less energy and water and other resources, much less than the current hospital currently does, saving San Franciscans money year after year down the road. And that in building this project, we are making every effort to make sure that that $887.4 million not only gets a great hospital built, but along the way provides opportunities both for San Francisco residents and for San Francisco businesses. This is our local stimulus project right here, a nearly $1 billion project happening during this economy. Couldn't have happened at a better time, and we are committed to making sure that San Francisco businesses and residents benefit from this. So we're very pleased to be here. Thank you to the voters for giving us your vote of confidence last year, and congratulations to the Department of Public Health and the people of San Francisco for the great facility that's going to come. Thank you.
Now, one of the challenges that you all will recognize is that you're standing on where the new hospital will be. But during this next 5 years, we can't forget about the hospital there, because that's where our patients are going to be. So on that note, I want to thank and recognize Kathy Young, who has the responsibility of keeping all the other facilities going. Kathy, you know, that's around here in the public sector, she does that with a lot of duct tape. You know, we have certain, you know, ends of mops that are used to move certain engineering equipment, right? I know all of the secrets from having been here. I want to also recognize we have a great chief of nursing, Sharon McCall-Witcher, who's here. The administrative team, Roland Pickens, Del Vecchio Finley, I saw you here somewhere. Our make sure that it all works well. We're very grateful to you. I also want to note Dr. Talmadge King, who's now head of medicine at UCSF, our former head of medicine here. He watches over us and makes sure that the university is fully supportive of our efforts. We're very grateful. Dr. Hal Yee, our chief medical officer, and I also can't miss the chance to say there's Dr. Elliot Rappaport, the former dean, who also taught me everything I know about cardiology, which unfortunately, Elliot, isn't really that much. So, but we really appreciate, you know, the number of years. Dr. Rappaport is one of those people who stayed 6 months and may now be up to 35 years. And how many years, Elliot? 49 years, right? That is the typical San Francisco employee. I also want to say we're a big believer in the health department that people need hospitals. Hospitals are critical, but hospitals are not where we want people. Where we want people is in the community. We want to keep people healthy. We want people seeing their primary care doctors, whether here or in the community or at the federally qualified health centers through Healthy San Francisco, and for the incredibly rich array of community-based services that either keep people out of the hospital or give them a warm place to go. Barbara Garcia, my deputy, over all the community programs. She does a fantastic job. It's now my honor to introduce to you Judy Guggenheim. She's the president of the San Francisco General Hospital Foundation. Without them, we would never be in this position of being able to be talking about a new hospital. They have been our friends, our supporters. They have helped us to raise money. They have helped us to raise support. And no one has been a more enthusiastic spokesperson for this hospital than Judy Guggenheim.
Thank you, Mitch. Every time I stand up and talk about San Francisco General, I feel humble and I feel proud. I feel humble because what goes on here is in a public arena is the most remarkable consensus of all kinds of groups all across the city working to make this hospital something that not only can we be proud of, but that is recognized all around the country as the very best of the best. Our programs go nationwide. Our research goes nationwide. Every time I bring somebody here who's never been to the hospital before, they all just go away just filled with energy and enthusiasm and, wow, this is the best place I've ever seen. So that's why I feel humble. It's also why I feel proud. It's a remarkable thing to be able to stand up and say, what goes on here because of the work of every single person involved here, and now because of the work of 84.5% of the people in the city, is just unheard of. I know we're going to have a fabulous new hospital. I know WebCorps is going to do a wonderful job. I know Fong and Chan have done a fabulous job. I think the mayor's office has just done a remarkable job, and the Board of Supervisors and the unions and the Republican Party and the Democratic Party and the business community. But most of all, I think all of you and all the voters in this city have something to be really proud of. Thank you.
I'm going to close. No, Terry Saltz is the one from our side taking the lead on making sure that the hospital fits in terms of the new building and our facilities. We're going to walk down now to where you see the shovels. We hope you'll stay and watch the mayor as well as the Health Commission and other elected officials take that first shovel of dirt that brings the new hospital. Thank you all so much for coming.
We'll do a countdown. You think we'll start at 5? That's easier. I'll start at 5, 4, 3, 2, 1. Done. Construction begins. Congratulations. Congratulations. Well done. What fun. Get in here, Jim. Congratulations. Congrats. Congratulations.
Hey, head down.
You do the same thing? Yeah. All right.
Again?
Yeah. You got it? Yeah. 1, 2, 3. Go.
Okay.
Okay. Don't get a good dirt on your shoe.
Jane, Talmadge.